course of the program. But first, let's begin with the story where for many Nigerian women, especially those who may require Caesarean delivery procedure, the federal government has enabled the process free. According to the coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, who made the announcement in Abuja, no woman should lose her life simply because she cannot afford a C-section. The development came as the minister launched the Maternal Mortality Reduction Initiative, a groundbreaking effort by the Federal Ministry of Health and Social Welfare aimed at tackling Nigeria's critical maternal and neonatal mortality rates, among the highest globally. He also assured that the government was committed to improving maternal and neonatal health in Nigeria. This is a good one from my perspective, addressing the matters of maternal health and maternal mortality. It's crucial because some women go through challenges trying to give birth, and the only option is a C-section. And because of the cost, some persons cannot afford it. And there's also the aspect of cultural beliefs and religious beliefs. There are those who believe that the best way a woman can have a baby is by natural means. She just pushing and delivering the baby, and that's the woman who has to go through a C-section is not strong enough. But we need to also address that issue in the course of this program being put forward by the government, because as much as the government has good intention, how many people will embrace it to ensure that no mother, no child dies in the process? So I would encourage that we also look at advocacy, creating awareness with regards to this, so that a lot of people can embrace it, knowing that government is doing this for free.
Yes, government is doing this for free, and we have to also understand the reasons government is doing this. Now, Nigeria's maternal and neonatal mortality rate is quite high. Some of the statistics I got from UNICEF says that the neonatal rate stands at 34 deaths per 1,000 live births, with a significant disparity between rural and urban areas. And so in rural areas, it says there are about 44 deaths per 1,000 live births, and in urban areas, about 34 deaths per 1,000 live births. And so this is quite alarming, and that has prompted the government to do this and ensure that this rate is totally and drastically reduced. And it's quite commendable that this has come up. When I first heard the story, I felt, okay, this was quite a good initiative, and I hope that, like we have mentioned, several people take advantage of this, and the cultural beliefs that women who give birth via C-sections are not strong will have to stop, because that mindset has put a lot of women in danger. Of course,
I know a story where a woman actually died with the baby because her mother-in-law, according to the story, did not agree for her to do a C-section after the doctor said, I think the baby was breached, and that she needed a C-section so they can save her life and that of the babies. And so the husband, being perhaps tied to his mother's apron strings, decided that he can only accept what his mom says. And so the baby passed, and the woman also passed, unfortunately. So he lost 2 lives. Both of them, unfortunately. So this matters needs to be addressed. Of course, if you are concerned about, what are the risks involved, you can have a conversation with the doctor who will speak to you about it, because I believe that experienced hands are the ones that will handle all of these issues.
Yes.
And we'll have experienced doctors to handle these matters across the hospitals that will be used, and I believe they are federal hospitals.
The federal hospital, one thing I know about that is that they have experienced people there.
Absolutely.
They have strong hands, they have facilities. So it will also put a stop to the system of people going to giving birth at home with midwives coming to help them. They prefer you just have to
traditional birth attendants.
Yes. So preferably you go to the hospital. If the doctor advises to do a C-section, just take advantage of it. It's free. It's from the federal government, and it's for all women. So just do it, and you gain to that advantage. Your life is saved, your child is saved, and the child has a life to becoming someone in future. So,
and if you are concerned about anything with regards to, after doing a C-section, will you still be able to have babies and all of those? Of course, there are a lot of people who have had C-sections.
There are people
and
who have had several.
In fact, I used to have a colleague before I worked in TVC that said that her babies, she had them through C-section. It was an option she decided to have because she felt it was safe for her. So C-sections are safe.
Yeah,
you go to the right hand. So it's just to ask the right questions and go to take the directive government gives. And I want to also employ the government to put a structure in place, because a lot of persons now will rush to the hospitals. So there has to be some structure where perhaps there will be numberings, and also that everyone can take advantage.
Given to these women as well.
Absolutely. Let's quickly bring you the news update now. Nigeria's First Lady, Senator Oluremi Tinubu, has denied reports circulating on social media and conventional